Welcome to MasterMed Indications for PTCE 2026. This video focuses on preparing you for the pharmacy technician exam through certification strategy and key knowledge pearls. Let's review common exam traps and reasoning strategies. Avoid confusing indication with mechanism, and for OTC combos, identify all active agents. Also, master biologic suffixes to understand drug classes. For hypertension, common first-line agents include ACI, ARBs, and CCBs. Heart failure management often involves ACI, beta blockers, and loop diuretics. Post-MI includes dual antiplatelet therapy. Memorize these class suffixes. In diabetes and endocrine agents, metformin is first line for T2DM. Understand the difference between rapid-acting and long-acting insulin. GLP-1 agonists and steroids are important, and note the critical indication for levothyroxine. For psych, neuro, and pain indications, SSRIs are first line for depression, while SNRIs treat neuropathy. Triptans are for acute migraine but are contraindicated in coronary artery disease. Opioids like morphine and tramadol are scheduled for pain management. Key medication indications include amoxicillin for otitis media and sinusitis, and TMP-SMX for UTIs. Inhalers are split into rescue, albuterol, and maintenance, fluticasone. For biologics, look for the MAB suffix and remember the pre-treatment requirement for TB screening. Combination products like loratadine/pseudoephedrine treat allergy and congestion. For OTC considerations, omeprazole is for frequent heartburn. Remember the trap: OTC misoprostol does not exist. Review key supplements and herbal interactions. Vitamin D is for bone health. Counsel on the importance of skeletal integrity. Melatonin is for sleep disorders and jet lag. St. John's wort for depression induces CYP3A4, reducing the efficacy of oral contraceptives. Be aware of look-alike, sound-alike, or LASA drugs. Use Tallman letters to visually differentiate drugs like hydroxyzine and hydralazine to prevent medication errors. Wrong selection causes harm. High-alert medication classes include insulin, anticoagulants, chemotherapy agents, and IV digoxin. Narrow window scenarios require double-checking the dose and indication match. Verify indication with the specific dose and route. Here is a sample question on first-line hypertension treatment. The correct answer is A, losartan, and ARB. Avoid picking C, clonidine, which is second-line therapy. When a patient asks for a product with only pseudoephedrine, the correct answer is C, Sudafed. Claritin D, for example, is a combination product. For a GLP-1 agonist used for weight and T2DM, the correct suffix is B-tide. Master these suffixes for quick identification. The question asks for a contraindication for acute migraine treatment in a patient with coronary artery disease. Sumatriptan, a triptan, is contraindicated because it causes vasoconstriction. Tallman lettering distinguishes similar drug names. The pair that uses Tallman to distinguish an antihistamine from an antihypertensive is A, hydroxyzine versus hydralazine. The correct indication and warning for St. John's wort is B, depression, reducing OCP efficacy. It is a CYP3A4 inducer. When prednisone 40 mg daily is ordered, the primary indication is D, all above. High-dose corticosteroids are used for systemic, acute management of severe inflammatory conditions. For a pregnant patient with a UTI, the safest option is B, nitrofurantoin, especially after the first trimester. Focus on pregnancy categories and trimester-specific contraindications. For exam strategy, manage your time well, roughly 73 seconds per question. Use a scratch sheet to jot down drug class and suffix. Never leave a question blank, as there is no penalty for guessing. Use the three-step strategic approach for indication questions. Step 1. Deconstruct the question stem. Step 2. Filter by class mismatch. Step 3. Select by clinical guidelines to find the best answer. Remember to review all the knowledge pearls and exam strategies discussed in this video. Thank you for watching this video on MasterMed Indications for PTCE 2026. Good luck with your certification journey.